How much more growth should I expect? This is the result, so far, of 2,200 grafts implanted in the front and sides on January 11th this year. I am just curious to know how much percentage does account to the final result at present. How much more growth shall I expect? Will it match with the rest of my hairs?
Thank you for your question. You've submitted several photos showing essentially your front and side hairlines, and you state you had 2,200 grafts done in January of this year, and this is the result of your the status of your results so far, and you're asking how much more growth can you expect, and your concern is will it match the density of the existing hair? Well, without seeing preoperative photos and knowing more about your history, I can certainly give you some guidance on how I take care of patients like yourself who come to our practice after they've had a transplant, as you have. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed in our practice that evolved from hair transplant surgery using regenerative medicine technology, but instead what we are doing is non-surgically helping men and women with thinning hair. In addition, we also help patients from around the world as well who have had hair transplants who are looking to optimize their coverage, and I'll explain the basis of this. So to begin with, the questions you're asking are questions I'm sure that you've already addressed with your surgeon. And I would say that your surgeon can give you the best guidance as to what the anticipated results will be. You received 2,200 grafts, which is a very respectable number of grafts. It's not just the numbers of grafts that matter when it comes to hair coverage. Scalp coverage is essentially a function of density of hairs as well as the thickness of the hairs. So basically, simply put, even if you don't have a high density but you have thick, wavy, or curly hair, you'll get scalp coverage that can blend a lot better. Now, that being said, when I evaluate a patient like yourself in our practice who has this concern, and for whatever reason, maybe they had their surgery done outside the United States and they're in New York and they're concerned about the optimizing their results, when we look at them, we basically look at whether or not they have native existing hairs currently present where the transplanted hairs are. And the reason for that is with hair regeneration, what we have been able to do is stop the progression of their hair loss, thicken existing hairs, as well as reactivate hairs that are not growing. In addition, we've also been able to expedite the growing of the transplanted hairs, depending on the timing. It's usually most effective when we treat people about a month after the transplant, but up to 3 months after transplant, we've seen results of the hair transplant actually growing sooner, as well as improvement of the quality and quantity of their native hair. In many ways, they actually look better than would have been anticipated, and the transplant surgeon gets to take credit for that. But the point is that it all depends a lot on those variables and whether or not you have hair present in those areas. If your hairline was actually lowered and you were going and you're having transplants in areas that did not have thick terminal hair, then there's a good chance, if your density isn't quite as significant or in numbers the same as the hair right behind there, then you're going to see a difference between the two areas. And typically a transplant surgeon will say, in order to improve density, you'll need another transplant. But again, this is something that you would have discussed certainly with your doctor, and understand that it does take at least 1 year before the transplant's full results are appreciated. And in some patients, it can take longer. Some people have slower growth cycles and it just takes longer. I've seen patients actually have less hair by the time they reached 12 months, and then 18 months they had more hair. So, but that's more of a on the outer limits of the normal. The typical average is about a year. Now that being said, you have to also, it's important that you do something about stabilization of your hair loss. And I'm sure your doctor discussed with you the drug finasteride for lowering DHT, as well as other ways to try to maximize your growth. In addition, in our practice, what we do is we do a procedure called hair regeneration, as I mentioned earlier. Here we're treating men and women with thinning hair, and we're basically helping patients who have already had transplants, let's say a year or 2 years earlier, and they're starting to notice that they're thinning and they're losing hair and they will probably need another transplant. Well, what we're able to do is actually treat the scalp with an injection treatment process, and we're able to, again, reactivate hair that's not growing, thicken existing thinning hair, as well as prolong the growth cycles so that there's more coverage. And that's what that goes back to the original point. When you've lost hair significantly enough that you notice it, you've lost about 50% of your hair. So the goal is not attainable, is to restore all the hair that's lost, but to create coverage. And so looking at your photos, your hair does look very thick and wavy, and I suspect that your transition between your transplanted hair and your existing hair should work out favorably. But again, this is a discussion for your hair transplant surgeon. Moving the clock forward and thinking about your future beyond the next few years, you may want to consider drugs like finasteride to slow down your progression in DHT blocker, as well as this newer regenerative medicine technology that we've developed starting 7 years ago that now has tremendous establishment as a real category in the treatment of hair loss, that you can actually try to maximize your coverage and prolong the growth cycles and delay the need for future transplants as long as possible. So I hope that was helpful. I wish you the best of luck, and thank you for your question.